We're here today to talk about recovery, substance abuse recovery in particular, and our panelists are here to give their view on what recovery means to them. First, I'd like to share some information about what we're celebrating in the 25th Annual Recovery Month. September 3rd, Adams County will kick off with an event and a proclamation. The prevention providers will be at the Commissioner's Chambers office at the Adams County Courthouse. Also on September 3rd, we're doing the White Rose Community TV, which is what we're doing now. September 4th at noon, the York County kickoff event and proclamation by Mayor Bracy will take place at noon at Cherry Lane in York. September 13th, we'll have the 3rd Annual Community Recovery and Awareness Conference in Hanover. For information on that, you can call 717-968-3083. September 13th, Raise Project will have a dinner and comedy show, which is a fundraiser. This is featuring the Emmy Award winning comedian Craig Shoemaker. You can get information about that by calling 717-232-8535. On September 14th, we'll have our 5th Annual Recovery Event and Health Fair in conjunction with the York Revolution at the York Revolution Stadium in downtown York. Now, let's go around the room and just talk a little bit about what recovery means to you. Would you like to start?
Sure. Hi, my name is Bob Allen, and I am a person in recovery. And recovery for me at one point, back March 1st, 1989, was a matter of life and death. I mean, it was a situation where my life had totally spiraled out of control with drinking and drugging. I was trying to run a business. I was trying to keep my customers from knowing I had a problem. And my friends and family were pretty much at the end of the rope with me. And so I had a friend who had gotten clean and sober about a year before that, and I really didn't know where he went or what he was doing. And I ran into him, and he said he hadn't drank or drugged for several months, and that kind of got my attention. And he started talking to me, and so from several months prior to March 1st, 1989, I'd struggled with, am I going to stop drinking? Am I going to stop drugging? Do I have a problem? You know, in spite of all the evidence, I had a problem, and I think, you know, in my mind, I was still wrestling with, you know, am I making too much of this? Can I just do it on my own? Can I stop drinking and drugging? So when I first came around, recovery was a real personal thing to me. It was a sense of urgency and emergency. It's something that I didn't understand or have any idea what it was, but I knew I needed to stop drinking and drugging, and I went to a recovery meeting, and that started my experience with recovery. So.
Cool. How about Darren?
Yeah. My name is Darren Mosley. Also an individual in recovery. In addition to, I'm also program director for Gundenthia Concept 90 in Harrisburg. And recovery for me is simply defined as I'm gaining freedom from the self-imposed imprisonment that I created on myself. I always say that because, you know, when I was in active addiction, you know what I mean, I was the only one that didn't know that I didn't have a problem. So, once I realized I had a problem, you know what I mean, I have a sense of freedom, you know, from with the help of others. Mm-hmm. You know, I went to treatment, got the information I needed, and I started this journey, you know what I mean, for, you know, just enriching my life, you know, to live, it's like a restoration back to where I was supposed to be in life.
How about you, Mike?
My name is Michael Kay, and I'm a person in recovery. And to me, recovery was a matter of life and death also. Mm-hmm. I was diagnosed with advanced stage cirrhosis, and back out using again because I didn't know how to stop on my own. And what recovery couldn't happen for me until I was willing to reach out and ask for help. That was one of the most important things to me. And what I've gained through recovery, coming up on 2 years in a recovery program, is today I can deal with who I am, and I'm okay with it, and I have the ability to give and receive love today. And that's something that I couldn't do for 23 years. And today, you know, I just try and do the right thing and be there for others.
Okay. Thank you. Substance Abuse and Mental Health Services Administration, or SAMHSA, gives a working definition of recovery as a process of change whereby individuals work to improve their own health and wellness and to live a meaningful life in a community of their choice while striving to achieve their full potential. Betty Ford Institute also states, recovery is not clear to the public, but individuals in recovery know what it means to them and how important it is to their life. What would be your definition of recovery? Let's start with Mike on this one.
Okay, my name is Michael Kay again. And like I shared earlier about the health problems, you know, I realize that recovery is for anybody that feels like they're out of control and they just can't control what they're doing in life, and if they need to stop and can't do it on their own, it's available in the community. And York is a great community to get recovery in, is what I have found in my experience. And you know, with the health problems that I had, I was told by doctors that there was no medication for me. What I had to do was quit doing what I was doing. And through this recovery plan, that's available to anyone that's willing to reach out and ask for it, they can have, you know, peace and happiness in their life, like I have found through this program.
How about you, Darren?
Well, I both agree with both of those definitions. What I've, in my experience, I believe that it's a journey for a person seeking, you know, fulfillment of life, you know, become a productive member. Being an individual who works in this field, you know, I think everybody seeks the same thing, you know what I mean? Once they find out, once they gain a sense of what addiction really is, you know, once they're informed, I think we're all looking for wellness, happiness, based on the imprisonment that addiction provided us, you know what I mean? So, and I think it is individual, and sometimes people are not, other people can't define other people's journey. So that's why I agree with the Betty Ford, and people might not understand what journey you have to take in recovery. So yeah, I agree with both of them. I believe most people who experience addiction and want to be productive, but don't know that maybe services are available, but don't know they can get out. They're caught in a hopeless dilemma, we call it, you know, that because of the progression of it. So yes, I disagree with both of those.
Thank you. How about you, Bob?
Yes. Just to, you know, my recovery took me into the field that I'm in today. I'm the founder and the executive director of Life's Beacon Foundation, and what we have is a life skills program, and that life skills program is my definition of recovery, because that's what I can share and provide for the guys that come through that program. And my experience, my definition is my experience, which is when I came to recovery, I wanted it to be about, if I just stop drinking and drugging, everything's going to be okay. And the longer I stayed clean and sober, that was proving to be not true. Matter of fact, that was the give me. That was the, you don't get any credit for that, really. If my brain could pop up on a smart TV and you could see all my experience with drinking and drugging, you would instantly come to the conclusion, that guy shouldn't drink or drug. But I was the last one to come to that conclusion. In recovery, I was starting to see over about a 5-year period that I need to change. I need to change my lifestyle, the way I think, how life affects me. And I was trying to come up on that with my own, to go into recovery meetings and come up with that on my own. And I think the biggest disadvantage that I had my first 5 years clean and sober was that I didn't go to treatment, that I didn't get a professional counselor, that I didn't work through the issues that were still keeping me unmanageable and emotionally unstable. And that ended tragically. Now, I'm one of the types of people that come into recovery that my ego is such that I'm not going to relapse. You know, I'm a hard-driven, self-made entrepreneur, one of the most self-willed people you're ever going to meet. So I'm not going to come back in the rooms or in recovery and say I relapsed. I commit suicide. That's what I would do. And I've experienced guys that come into recovery and they're constantly relapsing. They'll go a week, a month, a year, and they're always relapsing because they did the same thing I did. They didn't really deal with issues or change their lifestyle. They're just trying not to drink and drug, get a job, work, build up, get a car, build up the outside, be okay on the outside, but not deal with the inside. So then you have those who do come to recovery, go to treatment, get it, and they turn their life around in a few short months and not have too many problems. They get right back out into mainstream society. That's not so many. It's usually the other two. It's either struggling with relapse or struggling with the ego. But we're all fighting, not changing. And so my definition would go from that experience that when a man comes to my house, you know, I try and see what he's done. Have you gone to treatment? Have you experienced any counseling? Have you worked on any issues? Okay, good. If you have, that's good. Let's continue that. If you haven't, let's start that. Because at some point, when you're done getting over not being able to drink and drug anymore, you're going to have to change your life. And if you could do that on your own, there wouldn't be recovery. You could just decide, well, you know what, I've had enough of this, I'm going to stop on my own. So my definition of recovery really is a person who needs to stop drinking and drugging, comes to the conclusion that he wants to, and then does, and then really recovery starts then. I always say there's two bottoms. The one that got you to recovery, whichever it is, you might lose your job, your wife, your kids, your life, whatever, you're living on the streets, whatever drives you into the rooms or into treatment. And then the second bottom, or the second part of recovery, is when you change. And that can be a gap of a few short months to years. For me, it took me 5.5 years, and that ended tragically, clean and sober. And so my life skills program is based around that experience, that, you know, you need to get well, you need to get healthy, and everybody's path is a little different, but that's the criteria. Stop drinking and drugging, and then address the issues, whatever they are to you, because everybody's journey is different. Everybody's issues are different. Everybody's raised, their environment was a little different. So,
Thank you.
Yep.
The next question is, how difficult is it to maintain sobriety or abstinence, or is it even difficult at all? You want to start with this one, Darren?
I guess I could. I believe it is difficult, because I think we're dealing with, the disease of addiction is very complex. It's a threefold disease. It has stresses in people's lives are exacerbated, and you know, if people don't have the tools or education to understand what they're really dealing with, right, it makes the journey real difficult. And most individuals, I think some of it's still, most individuals, because with the stigmas that's attached to, you know, being a drug addict or being the black sheep of the family or whatever it may be, makes it hard for a person to accept the reality that they're struggling with something they can't control. For instance, in my facility, we have noticed that probably during intakes, a person might experience quite a few treatment processes before they actually get it. You know what I mean? So we believe treatment works, but for sometimes it might take continued education. Like I agree with Bob says, you know, unresolved issues, you know, sometimes they don't resurface right away. You know, they don't resurface right away. So it might take a person to go back through once or twice, use different programs to really gain the insight that, hey, I have a problem. And not only, once you get that, you got to accept it, and then accept you have to find a new way to live. Mm-hmm. And that's why we always express it at Gaudenzia. Gaudenzia has a motto that says right living. You know what I mean? Once you accept it, you know what I mean, you have to change the way you live, because you're living a new way of life based on the situation you have. You know, and I tell my clients this all the time. Why would you trust your thinking? You know what I mean? At this point, you know, as you hear, and it helps them to change perception. I need to find a new way to live. So I believe it's difficult, because I believe it's progressive, and if people are not informed, they don't get the opportunity to really understand what you're dealing with.
How about you, Mike?
You know, I'm not going to say it's easy, because life for me is not easy sometimes. But what I do have today is I have a design for living and some principles that I follow in my life. And I have another man that's already been through the problems that I'm going through now in early recovery. And if I stick close to this other man and follow these principles in my life, it's a lot easier than when I get off of that path and start doing my own thing. And it is my thinking. You know, I can make every excuse in the world for what I do, but I am my own problem. And until I take a really good look at myself and start to change the way I think and the way I behave and the way I react to situations, I have not changed. And when I quit drinking and drugging, that's when my problem starts, because I don't have a solution to my life then. So I stick close to another man that's been through the problem that I have, and I follow a set of principles in my life today, and I just do the best I can. And like I said, some days are easy and some days are not, but the fact is, if I do what I need to do, I don't have to pick up a drink or a drug today.
How about you, Bob?
Oh, it's easy. No. You know what? When I say it's easy, for me, when I came here, I was ready to stop drinking and drugging. That beat me bad. Mm-hmm. And that's why I was so mindseted on, if I stop drinking and drugging, everything's going to be okay. So I really haven't had an obsession to drink and drugs since I came here. Came into recovery March 1st, 1989. But my life got worse. It got extremely worse, because the one thing that was difficult for me, and I think is what makes recovery so difficult, was I had to find an effective way to change the way life affects me. And that required me to drop lifelong beliefs and stubbornness and just the concepts that were passed on to me by my father. My father passed on good things to me, like hard work, good work ethic, determination, never surrender. If something needs done, do it yourself. That kind of stuff. And that works really good in certain aspects of life. But on some other aspects, it doesn't. And that what made my recovery so difficult. I was fighting that. I wouldn't surrender. I wouldn't ask for help. I wouldn't take a look at, I would just keep fighting hard. If I do, it's an old saying, if you try harder doing the wrong thing, you're still going to get the wrong result. I mean, it doesn't matter how much harder you try. The big thing about recovery is the surrender process. And the things they mentioned is what helps that. Somebody that's been through it before, a mentor, your church, a pastor, a good friend. For me, I have a board of directors, and a couple of those members have long-term sobriety, and that helps for me to be able to bounce things off them. I have a sponsor, I have a mentor I have a group of men that I stay connected with. But effectively change the way life affects me. See, I have that today. So when life shows up, I have now it's just so ingrained in me that it's not even a process anymore. It's just kind of automatic, and life doesn't affect me the same. So life's pretty good today. So is it easy today? Yeah, but I've learned the hard way that that's something I need to keep maintaining, keep involved with. In other words, recovery's not a, let me get some tools, let me get some stuff, and then it ends and I can just put that all aside and go back. If you need to be in recovery from addiction, it's a commitment to a lifelong journey of recovery. And I've seen so many times where people just stop going to meetings, or they stop being involved in treatment, they stop being involved in other people's lives and just want to go back to being by themselves. And inevitably, the addiction creeps back in, and they either start drinking or drugging again, or sometimes even worse, they're not drinking and drugging, but their behaviors are such that they're worse off than when they were drinking and drugging. So it can be difficult when you choose to make it difficult, you know, and it's easy when you find a personal way to effectively change the way life affects you. I think that's the goal. So.
Thank you. Is recovery, do you think, something that can be forced on you, or do you have to be willing or want to change? I'll throw this out to anybody who wants to.
My name's Michael.
Okay.
I'll share on that.
Okay.
In my experience, I only have my experience to share. I could not recover until I was ready, because I was told that I had a problem for a long time by many, many people. Jobs, wives, girlfriends, friends, you know, and it wasn't a good idea until it was my idea. But once I realized that my ideas were not working out anymore and things kept getting worse, and I turned it over to somebody else and let them help me, then I was ready to recover. And that's my experience.
You know, most people come to recovery for the wrong reason. They're going to lose something, they're in dire straits, their life's completely falling apart, jail, prison. And life speaking, we deal with a lot of guys that nobody else wants to help, because we're dealing with guys that have felonies, in and out of jail. Their family situation is dire because their families had all they can take with their drinking and drugging and all the things that come along with that. And in spite of all those reasons to stop, it's still difficult for them because they really haven't decided they want that. The system or a PO or a parole officer or a job has forced them to go to treatment. And even though they have to say they're willing, because, you know, everybody says, well, now you have to want this. So for me, I think it's more important when I take a person into my program, it's more important to me how I let them out of the program than taking somebody in, because pretty much it's almost a given that they're coming in, they really don't want to be there. And what I'm doing is building for the next experience. Like Darren had mentioned before, people are in and out of treatment many times, a lot of times before they get it. And that's the truth. So what I'm doing is preparing them. I have plenty of guys that write me and say, hey, can I come back to your house? And I say, yeah. And then I give them an acceptance letter and I send it off. They're in prison again. And they write me back and say, oh, I got a 15 to 30 this time. After that, can I come? And I have to write them back. Well, if I'm still alive and if I'm still in this, yes, you can. But that's what I'm talking about. Now they know what we were about. They actually get it. They're ready for themselves to decide it's their idea to do what's necessary. That's when it works. And I learned a long time ago, you can't pick the winners and losers. So.
Do you have anything to add to that,
Yeah,
Darren?
definitely.
Okay.
Well, I have a motto, and I tell the clients, there's one thing I can't give you, is willingness. You know what I mean? I can give you the information, and that's why I'm a big proponent of treatment. You know what I mean? Because I think treatment gives the individual an opportunity to gain a choice if they want to change or not. And I'm glad, you know, one of the reasons I work, I love my organization because it's large. It's the largest nonprofit organization in Pennsylvania, and it gives people opportunities to, opportunity and specialized treatment to have that choice. I love Gadensia because we are a family. You know what I mean? We don't deny treatment to anybody. And because I believe people need that opportunity to get that choice to say, come to some kind of understanding, maybe I do want a different life. You know what I mean? Because I can give you information, but I can't tell you how to use it. You know what I mean? You have to have that, you know what I mean? And Bob said something that I think in the recovery community, we say it often. When you become beaten, you become willing. You know what I mean? And if they come beaten in our facility, that's great. If not, they're welcome to come back, and find a new way of life. So, willingness is something that comes within, and I think, Bob mentioned it. Recovery is an inside job. It comes inside out. You know what I mean? It's a choice to live a new life. It's a choice to live a principled life. It's choices the individual makes. They get to define it. You know what I mean? I'm just glad we can. I'm a proponent in treatment because it gives the individual opportunity to make that decision and find that choice, because they might not have it when they come in. Like you said, it might be Department of Corrections, it might be parole officer, they might do it for the family, all the reasons where, because they don't have a understanding of what they're dealing with right away. But as long as we have places like, I've seen Bob's place, and I know the work he does, and I know that there are other facilities and providers who do great work. As long as we have those situations where people can come in and find, have their own choice and find a way to live. They don't need willingness when they get there, but it's possible they can get it before they leave.
Nice. And this is a nice segue into the next topic. Would you recommend recovery and treatment for others, and why?
I think the thing I see now is there's a lot of treatment providers, which is good. The treatment's available to just about everybody that wants it, whether you have money or not, private insurance or not. You can get in treatment pretty well. I mean, if you want to go, they'll get you in. You may not go the day you want to go, but you're going to get in treatment. So it's available. The thing that I would like to see is the detox situation change a little bit, because when a person's, once they're detoxed, the center that's detoxing is going to find them a treatment center, and it's kind of a thing worked out by the administration. They can get help with that. But a person on the street that's in a dire situation, life or death situation, whether he may overdose, may not, or he's running scared because of he's on parole or probation, or he's just committed a crime, or he's done something, hurt his family again, and he doesn't want to go back home. He's stuck on the streets in a desperate situation, and he calls for help. I think that help needs to be availed right then and there. Not, well, we might have a bed in 2 days. Call me back, or keep calling me back. I heard it said that somebody calls for treatment and they get turned down, they don't get into detox immediately, so they go to a Home Depot and they steal a saw, and that whatever the amount of the treatment was going to cost to get them in detox is probably, let's just say $7,000. I don't know if that's a correct figure or not, but we do know that when he goes and steals that saw to medicate himself so he stops being sick, cost about $50,000, because they'll instantly avail treatment to him right away. The police officer will arrest him, put handcuffs on him, put him in jail. He'll go in front of a judge, he'll get sentenced, and he'll spend a year in jail. And so they're going to avail $50,000 worth of services instantly, when the man was asking to go to detox, which would have cost a lot less. That's a situation that I run into a lot when I'm trying to help people, because I'm like a street soldier. I'm helping guys that are on the street, and that's the most difficult thing about treatment, because once a person's detoxed, their mind's in a different frame. They're not in the same situation they were, and they can make a more informed decision about what treatment they want or what help they want, or if they don't want help. It comes back to that willingness. They may get out of their immediate situation and say, you know what, I'm not willing. I'll just go to jail, or I'm just going to keep using. but they also have the situation where they can make an informed situation and go get help. So treatment is probably necessary. You know, the old AA people will say, you don't need to go to treatment, just come to meetings. And that fell into me when I got there. A bunch of old AA people said, you know, you don't need to go to treatment. I wish I would have went to treatment. I did go to treatment, a sponsored state program upstate in a state prison for 6 years. And that's what helped me the most to deal with my issues. So it's imperative that treatment's available. I think that the detox situation is something, I've always joked around with some of the people in the field about, I'm going to start a free detox, street detox, free. Come anytime, 24/7, don't have to wait to get in, just come. Now, there's a lot of things that would go wrong with that, but it's just how I feel about detox being needed immediately when it's asked for. So that's what I think about treatment.
Yeah, I'd like to touch on a comment Bob made about, you know, I had this moment of clarity and I reached out for help and I received that help immediately. But I honestly don't know if I didn't get that help right then, you know, when the crying's over with, what would I have done? You know, would I have just went right back to doing what I was doing? And I see guys that ask for help and if they can't get in somewhere, they go right back, like Bobby said, to doing what they're doing. And you may see them again the next day, or you may not see them again, period. And I agree that treatment is, you know, really critical, especially when we have that moment of clarity and reach out for help. That help should be there.
Thanks. Anything, Darren?
Yeah, definitely.
Okay.
Well, I'm a treatment provider, so at Gandenzia, what I know is that when individuals seek help, we try to provide services for all populations. I know we provide detox. I know we provide services for women and children. I know we provide specialized services for mental health, specialized services for young teen boys, and I want to bring up something that's what I've seen lately is the rise of heroin addiction. And in my facility, in the last year, 57% of my population, their primary drug of choice was heroin. And the age was 18 to 34. You know what I mean? Mm-hmm. So I believe treatment is necessary because I just believe because as we're evolving, trying to treat the disease, it seems to be evolving, right? And it seems that most of the individuals are coming in younger, and I think with all the research that's being done to treat addiction, that treatment provides all that new information and provides an opportunity for us to fight this battle, you know, in a professional manner, and it just provides an opportunity for individuals to learn more about the addiction, because as it changes, we, like for instance, we're constantly going to trainings to find out what's going on and give these clients information, because I believe knowledge is key. If you give them all information they need, that gives them more power to, you know, focus on changing their life. So I'm a big proponent for treatment.
Can I add something?
Absolutely.
The treatment aspect is where, you know, Darren said something about if he's lucky if he gets a guy who's at that willingness spot when he comes to his treatment center that time. And, you know, that's the key to treatment. And even if a person asks for the wrong reason, all programs work. I'm not going to sit here and say, there's not a program out there that's trying to hurt people or is bad. They all work. It's whether that person comes on that willingness thing. So they may have to go through 6 treatments before they get to that one where they're willing. And that's difficult on the providers that get them when they're not willing. And that makes it hard, you know, like in the back of your mind, you know, say, why should I send this guy to treatment again? He's been there 6 times. Well, that's because that's the one we might get it. That's the one he might save his life, turn his livelihood around, become a member of the community again, get back in the family structure, raise the kids, and get back in. That's what turns his life around, is that treatment. So I don't think treatment should be based on, well, you've been here 4 times, so you don't need to go again. It really is the willingness thing. So is treatment necessary? Yes. Even to those, the heroin addicts especially, they need detox. They're not going to stop on their own. I've never seen a heroin addict say, you know what, I'm just going to stop on my own and stop on their own. They've been detoxed or put in jail, or somebody forced them to detox. They need help detoxing. The alcoholic has to be detoxed because he can die from it. The old saying, the heroin addict wishes he would die, the alcoholic will die if he goes into seizures. So detox is a critical point. Maybe they could develop that willingness thing at the detox point. Get them detox, save their life, because there's a lot of overdoses that happen because detox is not available when they call. That critical moment where they're going to go to detox. So willingness is definitely the key to treatment, to work anyway.
And if someone is looking for detox, there's an 866 number that you can call at any time, 24 hours, 7 days a week. It's 1-866-769-6822. And they will check and see if there's anything at all available at that time to get you in as soon as possible. So if you're also looking for treatment in the area, you can visit the York Adams Drug and Alcohol Commission website, which is www.ycd-a.org. And on there you'll find a list of all of the contracted providers in the area and the different service levels that they provide.
I just wanted to add that Cadenzia has a website, cadenzia.org. And on the website is a list of different programs and 800 numbers where you can find different services for all family members or any individual that needs help. So.
Okay.
Also, the provider I am is after treatment and or prison or jail or wherever you come from is it's lifebeaconfoundation.org is our webpage, and I think it's critical that people follow up after treatment for after treatment care, especially the outpatient treatment, the continued relapse prevention treatment, the individual treatment. And I say that because it's more than just not drinking and drugging. It's a lifestyle change, and that happens over a period of time through help from others. And so that's why we have life skills living situations for after treatment. It's why treatment can be anywhere from 30 days, 90 days, some of them are even longer than that. Children, women and children is a big thing for treatment to get people into the process of learning how to live clean and sober and changing their lifestyle. So
I'd like to make one comment on when I reached out for help, a man took one look at me and he said, I want to let you know that you don't ever need to feel this way again. And that has become so true in my life today. So that's the message that I would like to send out to the community. You don't ever need to feel that way again.
Thank you. As a reminder, some of the events that were coming up in September to celebrate the 25th Annual Recovery Month. September 3rd is the Adams County Kickoff with a proclamation at the Commissioner's Chambers office at the Adams County Courthouse. Also, the White Rose TV public event. The September 4th York County Kickoff event and proclamation at Cherry Lane in downtown York. September 13th is the 3rd Annual Community Recovery and Awareness Conference in Hanover. September 13th is the RAISE Project dinner and comedy show featuring Emmy Award-winning comedian Craig Shoemaker. And September 14th is the 5th annual recovery event and health fair in conjunction with the York Revolution at the York Revolution Stadium. And I'd like to thank you guys for coming out today and sharing your stories and giving us some hope for recovery. Thank you.
Thanks for having us.
Thanks for having us.